It's frustrating to have to examine a patient in a hallway where there's obviously no privacy for the patient.
There's a limited number of beds and we don't know how many patients are going to show up, so the question is how to best take care of patients.
It's a very busy emergency department. We see approximately 60,000 visits per year.
Well, we're busy, and it's manifested every single day with more than we can accommodate in our current facility.
As you come around the circle on 68th Street, even before you get to the main entrance of the hospital, you pass by the Lisa Perry Emergency Center, and that is where the care begins.
First-rate hospital has a first-rate emergency room. When we renovate the emergency room like this, the staff are in there and they're telling us how to make it better for them. We want them to help structure it, and that makes all the difference in the world.
One of the things that Dr. Fomenbaum wanted to do with the new ER, and he incorporated all of the staff in its design and planning, was to make it as geriatric friendly as possible.
It's very modern, very up to date with all the things that we may need. Considering we live in New York City, we never know what's going to walk in the door at a moment's notice.
Essentially adding on 50% more acute care beds that function as a separate emergency department. So in the case of a disaster or some sort of contamination, there can actually be two separate emergency departments going on simultaneously.
This unit incorporates the latest technology in air handling and containment of infectious diseases. The air handling for this unit is completely separate from the rest of the hospital and the rest of the emergency department.
This emergency expansion really comes at a critical time for us. The ability to deliver great care in a timely way with an increasing number of patients coming for our services is really important. You can't be the best without having a great emergency department.
Every day patients walk through our doors and are grateful for the care that they receive, and offering them the most state-of-the-art, contemporary, up-to-date facility is essential.
The lighting in this unit will duplicate day and night light cycles. The central area, which is largely constructed from glass, and the overhead monitors make it possible to keep track of patients no matter how far away they are from where a doctor or nurse is standing.
For many patients who come to the psychiatric emergency room, this might not only be their first visit to the hospital, so their first impression, but their first visit to a psychiatrist. So we want to be able to do our excellent clinical work in a setting that's both safe and comfortable for patients and staff.
Thanks to the donors, the staff here is able to provide that extra special something that we give to make everybody more comfortable, the patients' families, and the staff who has to work 24/7 to provide the most excellent care possible.
There is no day that goes by that I don't feel that we've helped people who really need to receive medical care quickly, efficiently, and in the best of all possible environments such as this hospital.
Without the generosity of donors, we wouldn't be able to provide patients with state-of-the-art care and a facility that is second to none.
It allows us to offer the best medical care that is available, and quality medical care and up-to-date medical care, and I think that's very important for a premier institution.
Lisa and Richard Perry are spectacular human beings, and their generosity is extraordinary, and we want to thank them because this emergency room will serve probably over the years millions of people.
I think it's exciting to be able to work in a new environment and still be able to work in the place that you love working.
We're all very excited to work in this new area. The fact that we had a role in helping to design and plan it makes it very special for us.
New York can feel some comfort. There's a great emergency service here, which, God forbid you have a problem, it'll be there for you.
Our many donors and the Perrys have made it possible for New-York-Presbyterian Hospital to have the finest emergency department ever built, and we are very, very grateful for it.